Hello, good morning. I'm Dr. Solana from Mexico, and I would like to thank the organizers of this forum. Increasing access to care in Mexico and at the ABC Medical Center, where I work. Mexico is very special in regards to medical care. Although everybody is entitled to medical care, we have 54% uh, patients without access to medical service. Only 0.3% have medical insurance or third payers, and 1% of the population are seen by public hospitals. 7.1 of the patients of the populations are seen in the ISTE hospitals, which are people that work within the government, and 37.6% are taking care at the IMSS, which is a health system from where a third of the pay comes from government, a third by the employees, and a third by the owner of the companies where they work. Although we have these institutions, due to barriers on time or place or economics, people decide whether they want to be treated or seen. As in here, where we can see that 36% are seen in private hospitals or doctors. 18% are seen in the CAF, which is doctors that have their offices in the pharmacies or drugstores, like what you have in Walgreens or in CVS. 2% other public hospitals, and the other institutions that I mentioned before. Now, of people that have IMSS, 28% are seen by private physicians because they don't want to be seen there due to barriers that they have in the admission or sometimes the time for surgery or else. As you can see here on the ISTE health system, 38% want to be seen by private physicians, also due to barriers that they have, or 47% in other public hospitals. And also here we have the private medical insurance people that are treated in private hospitals. Now, at the ABC Medical Center, we are a private assistant institution with 370 beds between the two campuses, 3,385 employees, and 1,692 doctors, of which 138 are cardiologists with several subspecialties. What can we do for increasing access to care at the ABC Medical Center? Most of the people that we see come from insurance companies or are paid by insurance companies of third payers, and 32% are out of pocket. What do we have regarding cardiology? Cardiovascular access that we have. We have a CV diagnostic where we do genetics, imaging, where we have the echo lab, a CT, MR, PET, and nuclear medicine. We also have an EKGs, treadmill test, Holter, and ambulatory blood pressure measurements. We do cardiac surgery. We do vascular surgery. We have 4 cath labs between the two campuses, and we were the first to install an acute myocardial infarction code. Now, our door to guide is only 52 minutes. Also, we perform structural interventions like TAVI and mitrals. We do electrophysiology studies. We put pacemakers. We use CARTO and cryo ablation. We are very happy to have a congenital heart center at ABC, where most of the patients that we see are without money or on social assistance patients. And this year we did 122 and only 22 private patients. Okay, this is at Cardios, which is run by Dr. Palacios, which most of you in Texas know. And also we have two clinics called Primex and Clínica de la Amistad, where we see also social assistant patients that are around us, at 5 kilometers around us. We take care of those patients without any fee. What are our barriers? Well, we are working on cardiac rehab. We are working now on a clinic for heart failure, a clinic for cardio-oncology. Although we have a great oncology service, still we are working to create a cardio-oncology clinic. We are working also on preventive cardiology, which is a barrier on us. It's very hard. And what are our major barriers? The economic. But we are using a price case management now, where we are taking view of patients on an individual basis and make a good schedule for them, also for payment. And public education, which is very low in Mexico about health, we are using the web. Again, I would like to thank the organizers, and if there are any questions, I'll be happy to answer them.